definition today is motivational interviewing for resident service coordinators. What you will learn today is the definition of motivational interviewing, how it can help resident service coordinators in their work, the techniques used, and a review. We want you to know the benefits of motivational interviewing in your assessments so that we can maximize the time spent with residents to provide patient, or in this case, resident-centered care. It is also important to note that the outcomes of case management when utilizing motivational interviewing are much more concrete because they're based on what the resident is willing to invest into their own successes and quality of life. So let's jump on in. The definition of motivational interviewing refers to a counseling approach that works on facilitating and engaging intrinsic motivation within the client in order to change behavior. It is a goal-oriented, client-centered counseling style for eliciting behavior change by helping residents to explore and resolve ambivalence. So let's get started. First, you want to ask permission. This communicates respect for residents. Residents are more likely to discuss changing when asked rather than being told to change. So examples of phrasing would be, do you mind if we talk about? Or, I noticed with your medical history, you have hypertension. Do you mind if we talk about how different lifestyles affect hypertension? This allows the resident to open up about the behavior at hand. You will want to elicit or evoke change talk. Change talk tends to be associated with successful outcomes. This gives the client a voice to need or reason to change behavior. Some examples of change talk would be, what would you like to see different about your current situation? Or how can I help you get past some of the difficulties you are experiencing? This step gets the resident to start thinking about an action plan to get from point A to point B. You will want to explore the importance and competence of the issue. This provides information on how residents view the importance of changing and giving residents a voice to what they need to do to change. An example of that is, what do you think you might do to increase the importance or confidence about changing your behavior? This helps you gauge if the resident is willing to change. Next, you will want to normalize. This is intended to communicate to a client that they are not alone in their experience or in their ambivalence about changing. It helps them to understand that it is normal to experience difficulty with change. An example is, that is not unusual. Many people report having made several previous attempts at quitting. Again, this validates their feelings, which is important in creating a partnership. You want to give advice and feedback. This is a valuable technique because residents often have little information or misinformation about their behaviors, which can open up dialogue to see if the client recognizes the need to change. So for this example, let's say that the resident wants to quit smoking. Do you mind if we spend a few minutes talking about smoking? What do you know about smoking? Are you interested in learning more about smoking? Remember, some residents will not want the information and will pretend to agree in order to change the subject. They may not feel the need to change at this time, and that is okay. The next few slides will talk about strategies used in motivational interviewing that will help guide you. So there are 4 general processes. 1. Engaging. Used to involve the client in talking about issues, concerns, and hopes, and to establish a trusting relationship. Focusing. Used to narrow the conversation to habits or patterns that residents want to change. Evoking. Used to elicit motivation for change by increasing clients' sense of the importance of change, their confidence about change, and their readiness to change. And planning. Used to develop the practical steps residents want to use to implement the changes they desire. In order to do these, you will need specific motivational interviewing strategies. You want to ask open-ended questions, listen reflectively, affirm, summarize, and elicit self-motivational statements. Let's start with open-ended questions. This encourages residents to do most of the talking and promote further dialogue where they can tell their stories. In contrast, asking too many open-ended questions can feel like an interrogation, so you want to be careful when using this. Some examples are, what's happened since we last met? Or what's different this time? This technique allows you to go a step beyond what the resident is saying to get them to start thinking about the change needed. Next is reflective listening. This is seeking to understand the client's idea and offering the idea back to the client to confirm that the message was understood by the listener. Some examples are, I get the sense that, or, so on one hand it sounds like, and yet on the other hand. This allows for clarification to make sure you are both clear about what is being said. Next, you'll want to affirm. These are used to recognize residents' strengths, successes, and efforts to change. These are positive statements. Some examples are, your commitment really shows, or it's clear you're really trying to change your. Next, you'll want to summarize. These are used judiciously to relate or link what residents have already expressed, especially in terms of reflecting ambivalence, and to move them on to another topic or have them expand the current discussion further. An example of this is, it sounds like you're concerned about your drinking because it's costing you a lot of money, and there is a chance you could end up in jail from drinking and driving. You also said quitting will probably mean not associating with your friends anymore. That doesn't sound like an easy choice for you. We will now talk about motivation and resistance to change. Self-motivation. Eliciting statements that support self-motivation is done by having residents give voice to their changes. This can be done by using scaling. This is a great tool to set goals with the resident. So some examples of this are, so while you may not have abstained from drinking every day this week, you have managed to cut down your drinking significantly. How were you able to do this? Or, on a scale of 1 to 10, where 1 is definitely not ready to change, and 10 is definitely ready to change, what number best reflects how ready you are at this moment to change this behavior? You'll want to remember that it's okay if a resident is never a 10 out of a 10, just as long as they are comfortable with their ranking. Now this is all great, but what if the resident is resistant? Remember that resistance is normal. Change isn't easy for anyone. Resistance to change can happen any time during the process, although it's important to identify whether the resistance is due to normal feelings of change or if the client is not ready to change their behavior at this point in time. So some signs of resistance are arguing. You'll see them challenging, discounting your ideas. They may be hostile. You might see them interrupting, so they'll be talking over you or cutting you off. They could be ignoring you, so you might not get a response, or they could be sidetracking to avoid having this conversation. Or they could be denying. They could be blaming, disagreeing, or reluctant. They could even be accusing you. So what do you do? Some strategies for handling resistance. Simple reflection. Acknowledgement of the client's disagreement, emotion, or perception. There's double-sided reflection. Acknowledge what the client has said and add to it the other side of the client's ambivalence. We will get to therapeutic paradox and the Colombo approach in just a minute. Clarification. Verify your understanding matches the client's perspective. Shifting focus. Shift the client's attention away from what seems to be a stumbling block, emphasizing personal choice and control. Assure the person that in the end, it is their choice to determine what happens. So let's get into therapeutic paradox, which we just mentioned. These statements are used with residents in an effort to get them to argue for the importance of changing. These are useful for residents who keep coming for their appointments but have made little progress. This technique does have some risk, as the client may agree with you instead of fighting for their change. So these should be reserved for residents that have been seen for a while. An example of what you can say is, maybe now is not the right time for you to make changes. The hope is that the resident will disagree with you and express their need to change and give them the control to come up with ideas to reach their goals. Then there's the Columbo approach. This is characterized as deploying discrepancies. It allows you to address discrepancies between what the client says and their behavior without evoking defensiveness or resistance. An example of that is, on one hand, you're coughing and are out of breath, and on the other hand, you're saying cigarettes are not causing you any problems. What do you think is causing your breathing difficulties? With any luck, the resident will acknowledge it is their current behavior that is causing roadblocks to change. Now let's start the planning or goal phase for change. Starting with negotiating a plan. You want to set specific, short-term goals. Make sure the client is involved in this process. You have to meet the client where they currently are and move at a pace that is not only comfortable for them, but is set with an end goal. You want to list pros and cons to changing the behavior. You want short-term goals to build their confidence to tackle their end goal without too many setbacks so that they can feel accomplished along the way. You want to consider the options. Discuss the different choices and approaches to making a change. Try to match the individual to the approach that seems to be the best fit. Recognize and prepare the individual that they may not choose the right strategy for them, and it might take several attempts or strategies until they are successful. Again, we want them to succeed in a way that works for them. Next, we want to establish a plan. You want to set goals, strategies, and tactics. You want to be specific. You want to summarize the plan with the client and put the plan into smaller, manageable steps if necessary. Make sure to assess if the person is now ready to commit to the plan. And importantly, you want to plan a check to see the progress of the plan, so you can adjust steps in their plan accordingly. Now let's review. Motivational interviewing is an important tool when working with residents. It helps them to think beyond their current situation and how they can find possible solutions to make their situation easier. Not all residents will be ready to change, and that's okay. Your job is to create dialogue and provide resources and information to residents, and facilitate change once it is expressed that they would like to seek change. By implementing some of these techniques, you will provide resident-centered care that will enhance the accuracy and outcomes of your resident assessments. For more information on motivational interviewing, you can go to motivationalinterviewing.org or motivationalinterviewing.net. Both websites offer tools and examples for providing motivational interviewing to residents beyond this presentation. We would now like to invite you to take a moment to test your knowledge on this presentation with a quick quiz. If you have any questions about this topic, feel free to send your questions regarding this module to your QA provider or supervisor. And thank you for joining us. We hope you find this topic useful in your work.